In the food systems there, this is the framework that we had developed. I was part of the group which did the report, HLP, Report on Nutrition and Food Systems, where we developed this framework of looking at nutrition as well as food systems. It's obviously a crowded figure here, but just to say that when we talk about food systems, we are talking about from the farm to the plate, and everything that goes on in between, and everything that determines what happens in the farm and what happens on the other end. So the drivers on the top, which have ranging from biophysical and environmental to political and economic drivers, that all of this, that finally when we take a food systems approach, then we are looking at finally what is it that people eat and what goes in their plates, how is that fitting into this larger economic system that they are part of. All of this has been thought of. There is a framework that exists, but within that there are some issues also that exist. One big issue is universalization of entitlements. And when I say universal, not saying that everybody is treated the same and it's uniform, but with quality and equity. So you will have to do more for some, less for others. But then there has to be a baseline for everybody as well. And then making all these programs nutrition sensitive. So we have a PDS, we have that system. How can we make it more nutrition sensitive? Can we bring in pulses, millets, edible oils into this, and not only rice and wheat? Can we expand budgets? Can we reimagine the procurement and distribution in a manner where, again, it's not just rice and wheat, it's not just these highly processed cereals, but can we do this thing of supporting farmers on Nutri-Millets and then distributing that to people through schools and so on? Basically looking at welfare measures as part of the mainstream solution and not as something that is an add-on, that it's an afterthought for the left out, but that it is very much from day one. If we think about each scheme from the nutrition point of view, then how would we imagine it? Thank you.
Nearly more than 60% population are affected by the anemia, especially due to dietary iron deficiency, and it is prevailing widely among women. Here we can add the gender issue as well, but women are more vulnerable than men, so they are more affected by the anemia. And if we talk about the South and Southeast Asian countries, the largest burden of anemia with estimated prevalence of more than 50% among women of reproductive age. Despite the implementation of 1,000 Days program, among various other programs targeted to a mother with newborn babies in South Asia, the reduction in anemia among pregnant women has not been significant and not satisfactory. Fragile health and food behavior of adolescent girl, as we already talked about, this period is a life cycle influencer period, and we called it window of opportunity, but in the meantime we call it neglected population for the sake of health and other take care activities.
The title of the session says Convergence, Inclusive and Accountable. So I think these are very fortuitously, aptly selected words. These are the Achilles heel of anemia problem. There is no convergence in ministry itself. 4 or 5 divisions are looking at anemia. It's not a disease, it's not a sign, it's not a symptom. 400 different clinical entities contribute to anemia. So that's where I think convergence is a huge challenge. Inclusiveness is also a major problem as far as anemia is concerned, as seeing our stagnation over last more than, I think, 50 years now, 1970 onwards, we have been taking stock of it. So I don't think anybody is accountable also as far as anemia is concerned. So I think these are very apt terms. So if we change our program and science too frequently, rightly or wrongly, it will have an impact in the program. Programs are not that elastic. They take time, and rightly so, they take a time. We have now dropped anemia estimation from our DHS, National Family Health Service. So you will not have a comparable data available to look at what were the trends for last 50 years or so. The 5 broad domains that we always say: government, industry, academia, NGO, civil society, or activists. They are the 5 pillars or punch of partnership, and all of them have to come together.
Thank you.
When this journey started, the most important pillars were technology, how the technology can play an important role here for enhance the manufacturing capacity. Then the partnership, there are many players for so far as food is concerned. It's not only one ministry, one department, rather there are many players, public, private players are there, and the research organizations, and also the business model, how we can bring a kind of demand and the demand and also the quality service delivery, availability of food. So all those things were part of that. So business model, how that can be developed in a very professional manner. And this model Food Fortification Resource Center, this was primarily like if you are trying to ensure the demand among the community, and also trying to ensure the proper availability of the food. It's important to have the standards. It's important to have the ensure supply. It's important to have the capable people. It's important to have the demand among the community, and also the surveillance and the advocacy. And primarily, if I summarize the Food Fortification Resource Center, this was created a research hub for the government and also for the many nutrition players, nutrition professionals. And this was a common platform how we can bring all of them together. And this was also a tool for advocacy.
Thank you, Dr. Ranjan.
Actually boils down to these 4 keywords. Even if we make 2 networks from here who tomorrow start working even on a landscaping work, it's as good as multi-sectorality to me. Coordination between 2 groups. We had today on the session in the first thing, several experts from different domains, which Sukarya has so nicely integrated and put together. I think that is what needs to be applauded and sort of amplified. And before I go, those of you who know me already, I love acronyms, and we've been seeing a lot of acronyms in the trials before. For me, I think my take home is PIN, the PIN, and it's not programs in Cornell, but it's the Nutrition Cornell program, but it's mostly to do with policy landscape as the P for multi-sectoral action. The I for innovative solutions, something which I showed you, Anup1 trial, the WINGS trial. There are some such beautiful studies happening on the grounds of India. They're published, but many of us don't even know that. So I think it's important that you get access to those repository, those data points, and understand how to integrate that, right? So those are the innovation solutions that need to come up. And third but not the least, last but not the least, is nature nurture. For me, climate is a very big influencer in nutrition, and it's going to become increasingly so. Sam Myers from University from New York is actually showing, he worked with our group before the Planetary Health Association, the PHA that he holds. Yeah, I'm just finishing. And then they show you very beautifully that if you give this extra carbon dioxide, or the foods which are being traditionally grown actually lose their nutrient content value. So there's a huge science which is emerging now, which tells you that apart from these nutrition specific threads, please focus on these areas as well. And with that,
nutrition education plays a very important role. In fact, in improving, not only maternal knowledge is improved, there is an impact on the child's nutritional status. Sanitation and hygiene, that's a very important factor. Figures by WHO suggest that lack of proper sanitation and hygiene is accountable for almost 50% of child undernutrition due to recurrent diarrhea and intestinal infections. So I think keeping a tab on hygiene and sanitation is again very important, and also to reiterate on the Poshan Abhiyan 2.0's position of nutrition care for adolescents. See, we need to avoid the vicious cycle of malnutrition, so I think we need to tap the adolescent girls at the right point, then the pregnant and the lactating women, so that we avoid this vicious cycle to perpetuate. Lastly, again, empowering women as key change agents by bringing in better policies and legislations. Definitely, we need to give them something to get something out of them. So, like, legislations to protect them from child marriage, early pregnancy, and increase access and control to resources. I think this could be a key agent for change.
Thought-provoking session. We have a lot of terms that we have to come to terms with. Accountability, convergence, inclusiveness, partnerships, multi-sectorality, innovations. So it's a lot of food for thought for us, and I hope tomorrow's sessions will also lead to a little more clarity. Dr. Karen, would you like to say something, please?
I just want to say thank you so much to all of the speakers. As they've shown, policies are not enough. They have outlined the factors that we need to consider in addition to a policy, such as all the factors that we need for inclusivity. Many of our policies leave so many people behind. And the conceptual frameworks that are going to hold us accountable, the questions that we need to ask and have answered, and the need for formalization of our partnerships. And of course, the need for translational convergence, for conversation, so that when we jump our silos, we know what we're jumping into.